the basic. I want the camera to be on my guest for today. Yeah, that's how beautiful my guest for today is looking. Ekia, welcome.
Thank you.
Want to talk postpartum care with you, and you are the best person for us to talk about. Now, last week we did celebrate International Women's Day, and today is the best day for us to talk about postpartum care. Now, we often neglect that part of life. We always talk about prenatal. There's a special care for prenatal, but when it comes to postpartum, we hardly talk about it. And there's even through that part of life. And Ekia is here. She's a midwife, Ekia Odruwa Nyama, and she will help us with this particular discussion. How are you?
I'm well, by grace.
It's good to have you here.
Good to see you too.
Okay. Ekia, now when we talk about postpartum care, we know people at home are wondering what is postpartum care. We know of only prenatal, but we don't know of postpartum. What is it?
Okay, so postpartum has to do with the first 6 weeks after delivery. So right from when the baby is born till a lot of things goes on within the stage, and that's basically what we call postpartum, yes.
Okay. Now, from now to 6 weeks after having a child, so what happens after 6 weeks? Is no more postpartum?
It is, but then we can say, move on and say, okay, newborn mother, because within that period, that is where the internal organs and everything is returning to its non-pregnant state.
Okay.
And so there are physiological changes and other things that goes on. So by 6 weeks, we expect that the uterus should, like before you conceived. And so you attempt as a newborn mother or that, but the postpartum is usually classified for the first 6 weeks. Yes.
What is a woman supposed to expect within that 6 weeks? I know you've spoken about the organs going back, but what else is to be expected? Because some of them will even bleed after having children and all of that. How long will that bleeding last? How long will the healing of the sore be?
For conception. Where in Ghana, we don't really place much premium on preconception care.
Right.
We only want to wait to get pregnant and then we go through the phase. But before you are thinking of getting pregnant, what you would want to find out, how fit are you to even conceive in the first place? And then in most cases, when we wait and it is not coming, that is where we want to seek care. So by the time they come, they're already tired. Now, this tiredness coupled with, the hormonal changes that they go through is all going to follow the woman throughout the journey and go through sometimes what we call traumatic birth experiences. And with the traumatic birth experiences, we're looking at so many things that goes on, which could be on the part of the health service provider, on the part of the pregnant woman herself, and then on the part of the family, or even the general system. Because if a midwife is working and logistics are not there for her to render the service, certain utterances are made or certain attitudes are shown, and then it throws the woman into a whole lot of psychological issues. And when they deliver, they might have delivered, but they still remember those episodes.
There's another woman in labor crying. It causes trauma to that mother. Is it true?
Well, labor pain is the highest form of pain, if you ask me. And everyone and how they go through their labor period. We have what we call precipitate labor, where contractions start, and within a short period, the woman has delivered.
But can that cause trauma? You hearing another woman, wailing?
It's psychological.
Okay.
And so at times, sometimes you even see pictures of accident victims, and a woman who is wailing might have progressed more than you who have started. So you tend to begin to ask yourself, is it what I'm also going to experience? Because we're waiting for 10 centimeters dilatation to say that you are fully dilated for the baby's head or baby to be born.
To be born, right.
And this woman is like 7-8 cm with contractions intensified and other things. You are just started maybe 2 cm or 3. And you're just watching how this person thresholds.
Right.
Some are able to really endure pain. They come in labor and you can just tell from their face that, look, but they are not showing any sign. Right. Like they are not crying. So you would want to treat every mother as an individual.
Okay, else it can cause the trauma.
Yes.
Right.
And you wouldn't want to compare them like, look at your colleague, the way she's quiet managing, because how I endure pain is different from how you will endure pain.
That's so true.
Yes.
Now, talking about this whole traumatic experience with feeding with a mother-child.
Oh, a lot.
Because
breastfeeding after delivery has to do with more of hormonal thing, which is the prolactin coming up to help with breastfeeding. Now, when psychologically you are disturbed, it suppresses that hormone. And so once there's a suppression, your society or people living around us, like, every cry of the baby, feed. The woman is already stressed. And then we also want her to care for this newborn baby. And so if we don't find a balance, it can trigger something that we don't expect to see. And so we expect the woman to be happy usually after delivery, but there are mood swings. Some cry uncontrollably. Some look. I have mothers always crying on me.
I cried. Yeah, I cried.
And I need those tears because the inbuilt emotions is not good. It will make you progress to other phase of depression that we don't expect.
Right.
And so we want you to voice it out. We don't want you to internalize it. Say whatever you're feeling. Say whatever you're experiencing. Don't intend.
Feeding aspects. You know, obviously, if your baby is crying, you don't know how to soothe the baby aside giving, you know, the breast.
No.
So in a case like that, what do you do? Because you're stressed, the baby wants the breast milk. What do you do? Okay,
so what we have to establish is that every cry doesn't depict hunger. They stop crying. And so sometimes you pick the baby and the whole bedding is wet, meaning the room temperature is too hot for the baby. And so a lot of things can make a child cry. You know, at that time is breastfeeding. And so the least thing, feed. The least thing, feed. The least thing, feed. You might even be doing overfeeding unknowingly.
Right.
Now we're looking at the woman that come and feed, come and feed, come and feed. What is the state of the woman who has to feed? You can't give what you don't have. And so it's transferred to the babies. So sometimes they become dull, they are not cheerful, and then it makes babies irritable. You want to soothe them and they can't, but you wouldn't know that it is what the woman is going through, which indirectly is being transferred onto the baby. And so you would want to find out what other things is making the child even feed. How do we do it?
Now, this is definitely something that people around the woman have to know. Now, what do they do to help, you know, with the baby for the woman to have the rest?
So we usually say the role of an in-law or the role of a help.
Or the husband.
A husband. We're roping men as partners.
Okay.
First of all, I think, most men leave their spouses to go for antenatal. And so whatever goes on in there, they don't even know. The public sector is such that some of our labor wards, you don't have a privacy to yourself. And so you cannot allow the spouse, there has been time, and you cannot allow someone's husband to be there to see other people's wives. Yes. But then that is what moving forward we should be working towards, so that a man standing there looking at whatever the wife is going through will they get back home. Because a woman who is going through a postpartum period needs rest, a good rest.
Right.
And if the man understands, okay, you finish feeding the baby, let me burp the baby, get some rest.
Right. So
what we should establish is that when a baby comes, there's sleep deprivation, mostly at night. You can't, you are not, you can't even tell when the time is going and day is already breaking and you haven't had a good. Try as much as possible, you the mother, to also get enough sleep as you can.
Okay.
It's not just about sleep, but you can just rest, because you might not be sleeping as in sleeping with your eyes closed, but you're resting the body. Ideally, everyone should get about 8 hours sleep. But then our situation, circumstances, the environment, the nature of our work, and the nature of things that we're doing now doesn't allow most of us to even get to that sleep.
That's true.
Yes. And then you have a presence of a baby, especially on them, so that they can go through that phase. Because when we want to help in an attempt, we overdo it. And when it's about the in-laws, that's where the challenge is. So I keep saying that in-laws do not mean harm.
Right.
It's the approach.
But if it comes from your parents,
even your parents, they don't
okay.
mean harm, but they still get it wrong at times. The approach. I gave birth to you. I when you were born, this is what were doing, and so this is what. Forgetting that a lot has changed. There's what we call evidence-based practice, where we've done a lot of researches, and that if we're saying that, okay, we don't put hot water at the fontanel of the baby now, what is the rationale? And so we don't bath baby until cord is falling, and even the cord falls or wanted to the navel to heal before we bath the baby. Why are we saying so? I feel that it's the approach, how they go about it, and you know, I think being fairly the person is going through. Maybe we gave episiotomy where we cut the woman during delivery. That sore is healing. She's unable to even sit well, and once you are in pain, you don't hear anything.
That's true. You don't hear anything. But Ikea, is there a particular care routine for postpartum? Okay,
so within 24 hours after delivery, we expect you to have a certain kind of bleeding, and so mostly midwives will be monitoring you at the hospital. And if it's even a cesarean session, you are still bleeding, we'll still want to monitor you. Maximum 72 hours, and then they are positioning the baby, how to attach, how to sit, how to get that rest. Because if you don't position your baby well and you don't feed well, the mothers will come back with back pain and other issues. Yes, so we don't want you to experience all that. Right. Then within the first 2 weeks, we expect you, the mother, to come back and see your doctor, and both the baby and the mother will be examined. Right. Then we move on to 4 weeks. 4 weeks, we see the baby as well. We see the mother as well. And then 6 weeks. 6 weeks, we are starting with vaccination and everything for the baby. And we expect that if it was normal delivery and everything is, if
there's no trauma
there's no trauma.
Yes. You can I think one of the biggest issue is with the trauma. Yes. Because that whole traumatic experience, even with some of the men who are in the labor ward, also experience traumatic issues. Yes. And with that alone, it's difficult for them to go intimate with their spouses. It takes a while before. So if you are able to overcome that, then you are good to go. But if you're home and you want to join the conversation, AQIC, if you have any questions with regards to postpartum, you can call us. I want to give us your number. I want to give you our number is 0302-211-69304. You can also WhatsApp us on 055-157-5757. Please do not call this number, just WhatsApp so we can read your message on air. 055-157-5757. That's the WhatsApp number. And for the phone call is 0302-211-69304. Or 4. You can also send us messages on our social media. We are streaming live on Facebook, which is Joy Prime TV. So do send a message there, or you can go on Twitter and send the message. Still, we can go ahead and do it. But let's not forget about the Ghana Education Service, the 10% money that they are taking out of the teacher's salary. We'll take a quick break. When we come back, I'll read a letter to you because some of you don't have any idea of what's going on. We'll be right back. Welcome back. You're still watching Prime Morning. My name is Roslyn Fairley, and this is Beyond the Headlines. And we've been talking about postpartum care. But reads payment of rent for occupying school and government bungalows. It reads in line with the effort to streamline the abnormalities with regards to the payment of rents for occupying social government bungalows. I wish to draw your attention to Ministry of Finance Circular number 13338/2016 requires that occupants of government bungalows are expected to pay 10% of their basic salary as rent. I therefore write to inform you that with effect from 1st of March 2022, all teachers and staff occupying school/government bungalow are to pay 10% of it issues. I hope you will comply and act accordingly. Thank you. This is from Felicia Ajebia Okai, Mrs. Director of Education, Westing. And this is to all teachers out there, and you have to pay 10% of your basic salary reactions on air. You can still put out your reaction on our Twitter page, on our Instagram page, and on our Facebook page. However, we are also talking about the Supreme Court ruling later on in the show. Is a special edition. It's being led by Samson Ladi Ayinini and the team from SMA. That's a Super Morning show. So you will not want to tune out from Prime Morning. We'll give you an extended version of that. It's definitely going to be very informative. So you postpartum care. And I'm here with Ekuya Nuyama, and Ekuya was actually telling me so much with regards to that. Now, something that we hardly talk about are people who lose their babies. Do they also have to go through the same postpartum care?
Be helped to heal because you carry the pregnancy, even with normal miscarriages, it's not easy. Not to talk of carrying a whole pregnancy to term and then deliver, and you are told that, okay, unfortunately, we lost the baby. You get mothers that need psychological care because until they heal, there's a likelihood for them to carry on whatever experience, even onto a next pregnancy. And until they heal, conceiving again becomes difficult because everything has to do with your mind.
Right.
And you need the healing. So they need more care than even the one.
And they still need to come to the hospital for the care.
Because we have to make sure everything is going normal, their system and everything, their hormonal.
Right.
So they still have to come. And in most cases, they would want to switch hospitals or they would want to change. But as I was saying, until you heal, whatever memory you have in your mind, you would carry it, and so you become paranoid, or you become, it means you haven't healed.
Right.
But we want to help them heal so that they go through subsequent pregnancies. And because I get a lot of mothers like, oh, this one, I didn't experience anything compared to
the other one.
The other one,
right?
You know. So.
Now let's talk about bleeding with mothers. New mama, you start bleeding.
Oh, it's worrying. There's what we call secondary postpartum hemorrhage, where everything was fine before mother was discharged home, and then she bleeds. Now, there's normal bleeding, what we call lochia. After delivery, it drains. And so the first 3 days, the color is bright red, call it rubra, and then it's serosa. It goes to, like, termination, where sometimes the woman will have to take the pad for you to look at the color of whatever fluid that's bleeding that is coming.
Right.
And so you're able to tell that, okay, after 7 days of delivery, color shouldn't be red, like it should be like a brownish. Those would have well contracted, the placenta size would have covered, and so we don't expect bleeding to be bright red like a fresh mother whose placenta site is fresh, and so it is bleeding.
Right.
Yes. And so they go through this phase maximum within 10, maximum 2 weeks. We should be fine. Right. Every bleeding should have stopped. However, that's where maybe there's a retained product of conception, even if anything little retains in the uterus. Look, the uterus is such that it will produce other things that will bring out blood, because in an attempt of releasing that blood to push whatever foreign body it's in there out. That's how it works.
Okay.
So usually when you deliver and it's
which is deadly.
It's deadly, yes. Because sometimes by the time they come, bleeding would have occurred in the uterus before it starts gushing out, and so you she might have lost the blood in her before it starts gushing out.
Okay.
And in some cases too, they don't report. They keep it to themselves, thinking that it is normal.
Maybe they think their menses has. Okay.
If you miscarry or an abortion or anything,
so immediately you spot blood after that first bleeding has stopped.
You should report.
So what if you still bleed after 10 days and it never stopped? What about that?
You have to come back for us to check, because we expect that within that time, color and everything should look at in a certain way. And so if it is not happening and you are still getting bright red bleeding and all, you don't have to stay at home.
Right.
You come, because sometimes you go in and scrape, and before you realize there are clots and other things in there. And when you leave it there, it can harm you can die.
Yeah.
So come. Whatever change you experience after delivery, don't stay at home and don't think that you are worrying us. That's why we are there.
It's your job.
It's our job.
Are there special meals that you can eat to prevent all these things?
So what I tell my mothers is that mostly when you deliver, because you're going to produce breast milk, you are losing lochia or the bleeding, you're losing fluid, you are urinating, you are sweating, or I am bloating. I am not against the fufu and the rice, but drink more soup.
Okay.
When we go for dinner or lunch or whatever, and the food assorted a buffet, and the soup as starter, it comes easy for you to drink the soup. So before you eat your fufu or your rice or whatever, can you fetch a bowl of soup? Drink it. You'll be more than halfway full. It will limit your carbohydrate intake.
Okay.
And because you are getting in enough fluid, you are replacing whatever is in you, and your system is able to get more fluid. You know what happens with breastfeeding? The whole mechanism is that breastfeeding has a lot to do with our brain and the hormone called prolactin. The food we eat gives the nutrients in the milk. It doesn't produce it.
Okay.
So you can take one fat cow a day. If you don't get milk, you don't get milk.
Right. All it's doing is giving the nutrients.
It's giving it is nourishing the milk.
How do you get the milk?
It's the pituitary glands and the hormone prolactin that is producing the milk. But it needs fluid. So watermelon with ginger, you blend, you are snacking on it, coconut juice or whatever. Because sometimes it gets so difficult for a mother to be drinking water alone. That's why our parents say, drink soup, drink soup, drink soup. They are right, but they are not able to tell you why they want you to drink more of the soup.
We hear granite and all of that. How granite and cherry
hormone.
So I just wanted to
they are all additives. They help. And you know, whatever you put in mind, oh, okay, I'm chewing granite and a broncheria so that I can get milk. It's your brain you are psyching.
Ah. So for the mothers who are not really getting...
And then letting it out. It has to do with the fluid in you. Now, if your fluid intake is minimal, your body will take up and make full use of it because you can't give what you don't have. So your blood level will make sure it is normal. You're getting excess for urine and other things. So until your body is fine to give excess in the form of milk. So you'd want to equate whatever you're eating with the volume of fluid you're losing and what your body lactates or able to get enough milk. You can get it when we correct this phase.
Okay, that's good to hear. We want you at home to join the conversation. The number to call is 0302 211 693 0302 211. So send us a WhatsApp on 055 157 5757 055 157. We are talking about postpartum care, and so much we've learned today. But then the biggest one is the postpartum depression. How does it all come about, Ikria?
Postpartum depression usually, so we have about 6 types of postpartum depression. The first one, we call it postpartum blues or baby blues. Right. It's a very mild or very transient form of depression, which mostly we don't see it. Parent syndrome or something where they ask the questions and I understand them because they are new to whatever they're experiencing. And then we have the postpartum anxiety, where there's a constant worry, feeling of dread about, is my baby breathing? You want to check. Is my baby doing this? Is my and they lack sleep because they have to get up and check if the baby, until someone is observing, you wouldn't know that this woman is going through this phase. Right.
Wow. I have Abba on the line. Hello, good morning, Abba.
Good morning.
How are you? Where are you calling us from?
I'm calling from Audumesi.
Okay, all right. Let's hear you.
Okay. I would like to ask, how long does it take? You have to tie your tummy. How long does it take to, go through that?
All right. Thank you so much, Abba. I think that's a question for the gods, because it's like everybody wants to tie their tummy. That alone is depressing. I mean, if you know you had some 6-pack and all of a sudden your tummy is out there, please answer it.
But then you should thank God that you have something to show for your tummy being out there. You understand? Your tummy didn't just get out there. A whole human being has come out of you. You normal delivery, 6 weeks to elapse, whereby the uterus would have contracted and gone back to its non-pregnant state. Then you can start doing your tummy time. But with cesarean section, it has a lot to do with your body type, and then the kind of section. Some people do cesarean, we do myomectomy or we take fibroids and other things. And so they don't go through dressing and other things.
Okay.
Usually by 6 weeks they have healed, but we would want to wait for like a minimum 2 months to 3 months before you start, because you don't want to put anything on it that can make the site gape or open up.
Right.
Yes.
Okay. I have a question. I experienced fluid discharge on the cut, which delayed the healing. Due to this, I'm scared, and I'll experience it again during my next delivery. What could be the cause, please?
Okay, so I think the wound site got infected, and everything has to do with the postpartum care. When she delivered, after cesarean section, what kind of incision site so it doesn't become infected? Because you can only discharge or come up with that blood, whatever discharges with the fluid when it gets infected. So, but make sure water doesn't get to that side and all that. If it is not done well, and mostly we rush through the education we give to our mothers, and that's where the challenge is. You can't also blame them to when they have to attend to at a time. However, we can still go to the extreme and make some more time for them. Let them know the consequences of not adhering to whatever instructions or whatever education you are giving to them.
Right.
So, as I'm saying, she has this issue and it has registered in her mind. So she is scared that she might experience. The fact that it happened to you doesn't mean it can reoccur.
Okay. I have another one here saying, hi, Joy Prime. I have delivered exactly 3 months. I'm still having the brownish blood discharge, but in very small quantity. Is it normal?
She should report to the hospital. Okay. She should see her specialist.
All right. Again, my tummy feels like there's a balloon inside when I press it. This is making me worry. I use the belly wrap and tummy goes down, but after some few minutes of unwrapping, tummy becomes big again. No visit was scheduled to examine me after 1 week examination. Kindly advise.
Oh, wow. That's unfortunate. And so using the tummy wrap and all that is just pressing the muscles down, but you're not really doing it if there's an underlying cause. And so she can visit any good gynae clinic or see any good midwife to do a thorough assessment. They might want to do a scan again and see what's happening, the location of the fibroid. If it has to be taken out, it has to be taken. The uterus will go back to its non-pregnant state, all right, when involution takes place. However, we're looking at the size and the location of the fibroid.
Right.
In some cases, it has to be taken off. If not, conception, subsequent and other things becomes difficult.
Right.
Yes.
You can still call us. Our phone lines are open 0302-211-693 or 4030 on the head of the newborn baby. Please, can we have other alternatives? This is coming from Elizabeth.
Okay, so what's the rationale in using the hot water in the first place? We have to just there's no alternative. Bath the baby, don't pay attention to the head. That's all. If developed after delivery.
Okay.
When in labor, there's what the head of the baby. It has bones, one on the right, one on the left, and then one at the back. So during contractions, as the baby's head is to be born, that's how come when baby's head are born, it comes out elongated a bit, and when you put them down, within some time, the head goes back to its normal state.
Right.
The brain is still growing outside the uterus to fill the capacity that it wants before these fontanelles or that bone fuses. And usually it takes 18 months after delivery.
Wow.
There are pores on the skin under the hair. And so when you put hot water there, the heat goes directly onto the brain. We don't want that because we want the child to be warranted.
Okay.
And so there's no alternative. Bath the baby, lukewarm water, and just clean with a towel. And that's it. You don't need to pay any special attention, because when you come and I put my finger there, looking at the age of the child, 2 weeks, 1 month, 6 weeks, I expect my finger to, the fontanelle to admit a certain amount of my fingers. If you are using hot water, I can tell. Wow.
Anyway, I have another one. I want to know how defect will it have, okay, he's trying to say the effects it will have on a child if the baby doesn't breastfeed for 6 months. If the baby breastfeeds for only 6 months, but not a year, sorry. That means if you stop breastfeeding after 6 months, is there an effect on the baby?
So we advocate for exclusive breastfeeding for the first 6 months of the child's life. And that's the most crucial age of the child's life, where everything is developing. And the breast milk is the best feed you can give to your baby.
Mm-hmm. But if you don't do it after 6 months, is there any side
Once you've given a good foundation, we are cool to go.
Okay. I have this one saying, is it normal to have your period 2 months after delivery?
Yes.
Okay.
That means you can get pregnant again. And so you want to plan.
Okay.
Get a backup, because, and a lot of factors, we have individual differences, our systems are different. And so some can even go as much as close to 2 years after delivery and their menses are not. But then the menses that is coming, what you should know is that you ovulate before you menstruate. Mm-hmm. And so because you're delivered, if this is the first time your menses is coming, you might have ovulated unknown to you. That's how come we want you to do a backup. If not, then a pharmacy. They are pregnant again. It continues, and when they come in, you say, "Oh, you are pregnant."
So after 2 months,
after 2 months,
delivery,
3 months. Oh, yes, you ovulated before you menstruated,
right. And
so if you had sex within that period, once it's after delivery, which your menses hasn't resumed, you wouldn't know. Okay. And after delivery, a lot of things changes in your you, so you can't tell, and so before you realize. Okay,
so this reads, hi Jared Prime, I had a ruptured ectopic. Please, can I give birth by normal delivery or CS, and how many children can I give birth to?
Oh wow. So it means once it's ruptured, if procedure was done, it means she's lost one uterus already, one fallopian tube, sorry. And you would want to see your specialist. It depends on the age and other factors.
Okay.
Because we are saying that, okay, cesarean section, not more than 3. Now people are going for 4.
Yeah, that's true.
A lot of things have changed.
Okay.
Yes. And so I know someone with a ruptured ectopic and still had like 3 babies.
Mm-hmm. Okay, so this one says, I would like to know when one is supposed to see her normal blood flow. Again, it's been 2 months after delivery, my blood ceased, but just within the week I experienced blood again. Kindly advise.
So you will want to go and check. If it is not if 2 months, as I was saying, 6 weeks to 8 weeks, you can get your menses again. Mm-hmm. But then you would want to be sure it is something else and not, your menses and not anything else. So they can do a scan, they can check your hormonal levels and other things and get to see that, okay, no, this bleeding is not normal. Or they would even want to see the kind of bleeding that's coming to see if it is normal or not.
Okay. I have a caller. Hello, good morning, Clement.
Good morning, madam.
How are you?
I'm doing great. How about you?
We are fine, thank you. Let's hear from you.
Please, I'm enjoying your lecture this morning. But I have a problem and I want to find out. Myself and my wife have given birth since 6 years now. We have been battling for another child, but it's not forthcoming. So I want to know what could be the cause of.
All right.
I want to find out from the midwife if there is a reason for that or...
Okay. All right. Okay.
Okay, so there's what we call secondary infertility, where you can have a child and then subsequent ones delay. You've been battling, but then where have you been going to? What kind of help are you seeking? Because I know from my practice that a lot of the infertilities are such that they didn't get a good person to even diagnose what the cause of that infertility is in that kind of care. And so by the time there's infertility is a very sensitive topic.
Nobody wants to talk about it.
Nobody wants to talk about it because we instead of helping, we rather compound their issues by telling others and all that.
And this could be from both parties, right?
Exactly. because the external family putting pressure that, hey, dabena second one neighbor, dabena second one neighbor. First one neighbor, you know, what were this, okay, we are trying. No.
Right.
And that secondary infertility, it could be coming from both sides. So there's that pressure that we put on women, that, but as we said, obano na okita awo adie. Like, so I would say, nonetheless, it is the egg, the sperm that has to swim to go and meet the egg.
That's true.
And so infertility is not entirely about, and in most cases, it could be coming from both of them.
Yeah.
So as we usually leave the woman to go,
which is not the best.
Yes.
I have Vera on the line. Hello.
Hello, good morning.
Good morning, Vera. How are you?
I'm okay.
Great. Let's hear from you.
Please, I want to ask a question.
Go ahead.
Yes. I'm breastfeeding my baby, and she's on breastfeeding. I feel so aggressive. Like, I get angry when she's breastfeeding. So now, and like, it has reduced a bit. But I thought maybe keep growing, or as time goes on, it will stop. But it's still the same. Yeah, I feel so angry and aggressive while she's breastfeeding. When she stops breastfeeding, I'm okay. But when she wants to breastfeed and she starts, I feel so annoying. And then with the menstruation, 9 months now, I mean, she'll be 9 months, I think early next month. I've not menstruated yet. I don't know if it is still normal, or people are saying when she stops breastfeeding, it will come by itself in breastfeeding. Yeah.
All right.
Thank you.
Thank you. Ikea.
She's going through postpartum traumatic stress disorders, and she needs to be counseled. She needs help, because being aggressive towards your child after a period of, usually it shouldn't exceed 2 weeks. And so as a caregiver, if it exceeds 2 weeks, I would admonish you to see a psychologist.
Okay, let me take this call and then we can merge the answers. Hello, good morning, love.
Hello, good morning, ma'am.
How are you?
I'm fine.
Great, let's hear from you.
I've given birth for 5 years now, and I've not who have miscarried. I've not get pregnant, so I don't know the cause. So I just want
another one, so
yes.
she doesn't. Okay.
Okay, all right, thank you, love.
I think it's just about the secondary infertility we talked about, and all we can say is that she has to see a doctor. We may have to run series of labs. Your hormonal levels, when they begin to drop, because we're looking at your age, so many factors.
Right.
Now you can deliver, and then based on whatever happened, you can develop adhesions or something in your uterus, even in the cervical canal, or you can be having any medical condition unknown to you. And when there's an adhesion.
Letitia?
Hello.
Yes, how are you?
Please, I'm fine. What about you?
Fine, thank you, Letitia. Let's hear from you.
Yeah, I have a question.
Okay, please go ahead.
Please, that was last year. I done a fibroid operation. Then I want to know whether I can give birth and the procedures I should follow so that I can give birth.
All right, thank you, Letitia.
Okay.
Okay.
Okay, so with fibroid operation, you can deliver.
Right.
It's a short interval. If the fibroid operation was like she was cut open to take it, because now there's technology that we take fibroids without cutting them.
Okay. Yes.
Hysterectomy, laparoscopic, and all that.
Yeah.
Yes, and so we go through all that. So if it was an open one, myomectomy as we call it, she can get pregnant again normally. And then if it is less than 2 years, she would have to deliver via cesarean section.
Okay.
Yes, because it's short interval. You wouldn't want
but the
contraction.
laparoscopic, you can deliver
yes.
normal.
Yes.
Okay. Hello, good morning, Mary.
Hello.
Thank you.
Well, I'm 30 years, a mother of 3. But I want to know, mine is different from what the midwife is saying. I have a 5-year-old boy, 3-year-old boy, and 1.5-year-old boy. Like every 40 days after delivery, my menses start every 40 days for all the 3. And my problem is, after 6 months, my kids will never breastfeed again. If I try to put it in their mouth, they will bite. All the 3 boys. So this one, what should I do? At least, because 6 months is not enough for my baby to stop breastfeeding. So I'm asking from the maid.
Hi, Dorcas, how are you?
I'm well. Please,
Great.
I'm a little bit older.
Okay.
I'll be 44.
All right.
I have one child. I've tried to get another, and it's becoming a hell for me. And even the first child was a problem. I had miscarriages before having her in 2019, and she will be 3 years this March. Okay. And I don't know. I've tried. In fact, it's frustrating me. So I want to know what is happening.
All right. Thank you so much,
Thank
Dorcas.
you.
Okay, so with Mary, once she's able to get good breastfeeding for them alone for the first 6 months, that's the ultimate goal. Okay. And so after 6 months, we're looking at, are the children eating well? Because the homemade food are also well nourished. That even if you were breastfeeding 6 months after, you're going to supplement or you're going to add other feeds.
Right.
And so she shouldn't worry. That 40 days she's talking about is 6 weeks. And so, as I said, 6 to maximum 8 weeks. There's no call. Okay. That's how, because you wouldn't know, that's how come we always say that get a backup.
Okay. Get a backup.
Get a backup. And now with the last caller, it is worrying you. It is your mind. Now, what you should know is that the hormones that works with pregnancy, lactating, and everything, or nothing.
Okay. So just relax
because
yourself.
We know that anxiety plays a huge role. You're too expectant, and that if it doesn't happen, then it throws you into this state. Your mood swings, you change your attitude, and before you realize, you are being frustrated. The least thing, you are stressed, or you will not conceive.
Right.
Relax. It will happen if you relax. And some mostly unknown to you by the time you say that you are pregnant without knowing. But you channel that stress into something positive and or seeking a better care, cooperating with your healthcare provider to achieve the result.
Right. Anyway, I have Patricia. Hello, good morning.
Hello, good morning. Please, I'm Patricia calling from Tamale.
Okay, Patricia, let's hear from you.
Please, I got pregnant for about 4 to 5 months ago, and I was told at the hospital that the baby is not getting oxygen to breathe, and due to that, I was asked to do DNC.
Okay.
And now, for about 4 to 5 months now, I've not yet conceived again.
I was just about to read your message. You did send me a message, right?
Yes, lost.
Yes.
And she's not conceived again.
Yes.
She's too desperate. Like, okay, let me not use the word desperate because our environment, our system has wired women in such a way that the expectation at a certain age mounts pressure on women. You would want to heal well before you think of conception again, because that's procedure through your uterus into a certain chaotic whatever state. You want the uterus to heal, relax.
The 5 months is not. I have another caller. I hit the phone lines of Baza. Hello, good morning, Monday. From what?
Hello, good morning.
Yes. How are you?
I'm fine, thank you.
All right.
Please, I'm calling from Wa.
Okay.
Yes. I equally have a problem. My problem is I once had an ectopic. I had a child before having the ectopic. So after the ectopic, I've been finding it difficult to conceive again. So I got married for about 5 years now. I can't give birth. So when I went to the hospital last year, after the operation, it gaped and they operated again. So I don't know. Is there a possibility for me to get a child again, to be pregnant again? Because, like you said, in a society that we are, I'm a Muslim, there's more pressure on me. My husband is not giving me the pressure, but the family and the society are giving me the pressure. Thank you.
I feel your pain. Thank you. Okay.
It's an experience you wouldn't wish it on anyone, especially when you've lost a child before. You know how it feels like. And with the the ectopic, you already know that one of her fallopian tubes is already technology. God has blessed us with technology or science, which is not a sin. It's about time we talk about IVFs. It's about time we talk about surrogacy, where it is my egg, it is my husband's sperm, but due to the nature of my uterus, someone is carrying it for me, and we still accept that.
And it's my child.
And it's my child, because when you do a DNA, it's going to be your hormones or woman. Not all of us can get to experience that. And how we project it on the women even puts them under more stress to relax to conceive. And so with the 2 surgeries in a row like that, further investigations need to be done. We also have to consider her age and other things. Looking at her,
I wish we had all the time, but let me take this last call. And I have a message from Nigeria. I would like to read it as well. Hello, good morning, Barbara.
Hello, good morning.
Yeah.
Okay, so I'm 26 years of age, and I was told I had fibroid. I'm married for like a year now, and even though I've not conceived yet, when I'm having sexual relations with my husband, I end up feeling this pain in my abdomen. And there's something blocking. I don't know what it is, but then there's always something sitting down there. So I want to know what is the cause and what I can do about it.
Right. Uchena, and it reads, is it true that once a woman gives birth through CS, she cannot give birth normal again?
It's not true.
Okay.
So there's what we call VBAC, that is vaginal birth after cesarean section.
Okay.
It happens a lot. Usually we say that if the cesarean section has gone on like 2, 3, then we wouldn't want you to try vaginal birth. But then if it's 1 and the interval is, say, after 2 years, we can let you try vaginal birth, but we would want you to try the vaginal birth at a facility where there is to be done.
Okay.
So you wouldn't want to try it in a lower facility where transporting you in a difficult labor, maybe you are in the 2nd stage and then emergency, we have to cut you or that kind of thing. Theater should be closed.
Theater should be closed. What about Barbara's issue?
Okay, so with Barbara's issue, you know, the issue just about a year into the marriage, and I would wish she takes time on herself. The pressure we put won't get and so once our mental prevent you from conceiving. So we need you to be relaxed, and then you go through seeking the right care. So further investigations must be done with regards to whatever she's going through. And
well, I have so many messages. Unfortunately, I can't read them. Over 50 messages. This one, Christabel said, please read mine too. But Christabel, I think you have the answer. She was saying she has cesarean 2 years ago and she's pregnant again. Can she have normal delivery, which you've spoken about? I wish I could read everybody's message, but unfortunately, questions. If you have a social media handle that they can go on there and put in more questions to that side, I don't know.
So, well, they can call or send a WhatsApp to 055-2388-260.
Okay.
055-2388-260. And I'm at Elima's Health. We're located within the airport residential. About women's health, everything about babies' health. That is what we're specialized in. You can walk in at Monday to Friday anytime, and then you have the best of care. We can take your fibroid out without cutting you. We'll give you, we'll pamper you, make you feel like, yeah.
Thank you so much for being here, Ikea.
Thank you for having me.
Today it's messages.
So they should take the number and they can send the WhatsApp or channel the messages onto that number.
Right.
And I will personally answer them.
Okay.
Yes.
So Ikea says she'll personally answer all your questions. So please make sure that you send all your questions through that number. We'll take a quick break. When we come back, we have more for you. But thank you, Ikea, for being here today.
Thank you for having me.
And Ikea Nyama is a midwife and